Good afternoon. My name is Saya Wen, and today's presentation will be on the relationship between workplace burnout and gastrointestinal symptoms. So first, we will be talking about the table of contents. The first thing that we will be examining is the problem under investigation. The next thing will be defining the variable. Third is empirical evidence. Fourth is the hypothesis. Fifth, research design. Six, we'll be talking about participants. Seven is materials. Eight is procedure. And finally, the reference section. So to begin with, problems under investigation. My goal is to find the relationship between gastrointestinal symptoms and burnout in mental health professionals. I believe if burnout rates are high, the number of times a mental health professional experiences GI symptoms will greatly increase. Next is define the variable. So like I mentioned, there will be two variables. The first is gastrointestinal symptoms. GI disorder is a condition affecting parts of the digestive system. GI can impact the overall quality of an individual's life. This is from Yetta et al. 2021. And GI disorders include PUD, gastroreflexive disorder, which is GERD, IBS, and IBD. Burnout is the second variable. Burnout is defined as a psychological syndrome characterized by physical, emotional, and mental exhaustion. Burnout has become a growing concern in mental health professionals as they experience secondary trauma, often while providing mental health services. And then next is the empirical evidence. In gastrointestinal symptoms, which from now on will be GI, 10 to 15% of adults experience GI symptoms, and that's according to Common GI Symptoms website. And then GI symptoms are common in individuals experiencing depression. And then also Dow et al. 2021 found that anxiety and depression are found in 30 to 50% of patients suffering from chronic GI symptoms. In burnout, 10% of employees have experienced it throughout their work career. Burnout in mental health professionals has been associated with decreased productivity, higher turnover rates, and increased risk for developing depression. Rook and Bozreg 2020 found that 61% of mental health professionals met the criteria for clinical depression. And then fourth is hypothesis. So my hypothesis is that mental health professionals who score higher on the Maslow Burnout Inventory general survey will present with at least 3 to 5 symptoms of GI in a week. Fifth is research design. So this current research design is a quantitative study that was completed online via Google Forms. The study will be within research design. Statistical analysis will include the two variables, GI and burnout, to determine if the relationship is statistically significant. And then an independent sample t-test analysis will be performed in SPSS 28.000, using the alpha level of 0.05. Then next is participants. We aim to recruit a minimum of 50 participants. Prerequisites for the study include mental health, working as a mental health professional. Participants in the study will reside in Virginia. Participants will be asked to identify as male, female, or other. In addition, they will be asked to provide their age. Participants will be recruited via electronic flyer sent out to directors of community service boards, counseling agencies, and other agencies that provide mental health services. Individuals who consent to participate will receive a link that will then take them to the Google survey in form of a Google form. Materials. So the survey will consist of 19 questions, 2 demographics, 1 question to identify symptoms of GI, and then 16 questions from the MBI General Survey Inventory that will examine burnout. Demographic questions. Participants will be asked to identify as male, female, or other. This will be a multiple choice style question. The second demographic question will be participants being asked to write their age in short answer format. A GI question will be a multiple choice question asking participants if they have experienced at least 3 to 5 symptoms within a week. The MBI General Survey will include 16 questions, and it is a self-report inventory that examines individuals' attitudes towards work. This comprises of 3 subscales, which include emotional exhaustion, professional efficiency, and cynicism. Eight is procedures. So as I mentioned, individuals will be asked to participate in the survey via phone and email. Those who consent to participating in this study will be emailed a link containing the Google form, which has all the questions. Only participants who are mental health professionals will be included. And then, of course, the statistical analysis will include the 2 levels. The MBI uses a Likert point scale ranging from 6 to 0, and scores higher in emotional exhaustion and cynicism have been shown to cause a lowerance in professional efficiency, which is a indication for burnout. And then the gastrointestinal will use a 4-point Likert scale from 0 to 3, which will be in the multiple choice format. And then, as I mentioned, the independent sample t-test will be used. And these are my results. I'm sorry, my results, my reference section.